Well, wow. Now that's a great question. No one has ever asked me that question before, but I think it's really important because one of the biggest problems in medicine is communications between doctors and patients. And it's not that the doctors aren't listening and it's not that the patients aren't talking, but they're not often on the same wavelength. So the best way to communicate to you what your symptoms are to your doctor are to start with by paying attention. So pay attention to your own symptoms and try to anticipate what kinds of questions the doctor is going to answer. The best way to pay attention to your own bladder symptoms is to keep a bladder diary. And you can do that without having seen the doctor. There's places you can find diaries online, or you can just make up your own. And the most important things in this diary is that just for one 24-hour period is to record the time and the amount of each urination, and then any symptoms that happen either during the urination, like pain, or before the urination, like difficulty starting or incontinence, or between urinations, such as incontinence when you cough or sneeze. And whatever your symptom is, pay attention to when it happens. So, for example, if your symptom is you wake up in the morning, you have to rush to the bathroom, and then you have to rush all morning, and then later in the day you're pretty okay. Look at what you're doing in the morning. The usual culprit for that is coffee, or the caffeine containing beverages. Pay attention to that. Write it down, and then after you've completed your diary and paid attention to your own symptoms, then when you can write them down beforehand. You can either give a piece of paper to the doctor with that information on it, or you can just read it off and you say my most bothersome symptom is rushing to the bathroom, or my most bothersome symptom is I have difficulty starting, or I wake up to urinate at night. Now, when the doctor sees you, of course, he's going to want to examine you. And when he examines you, if the problem is, for example, incontinence, he's going to want to examine you with a full bladder. A lot of patients, when they get to the doctor's office, the first thing they do is urinate. So if your bladder isn't full, and you complain of this stress incontinence, which means that you leak when you cough or sneeze, and he examines you and he doesn't see the incontinence, then he might think, well, you don't have incontinence, but you need to tell him, oh, my bladder really isn't very full, and it's much worse than this. And then he can formulate his judgment based on not only his exam or her exam, but what you've told him. Similarly, for people that complain of a weak stream or difficulty starting urination, the doctor is going to probably want to get a flow test, or at least if he's a urologist, he's going to want to get a flow test. He's going to ask you to urinate into a machine, and he's going to measure how forcefully the urine comes out, and then he's going to want to check whether you empty your bladder or not with an ultrasound. Well, again, if you've just urinated before you got there, then you're not going to be able to give a very good stream, and he may think that you're a lot worse than you really are. So the doctor needs to understand, and you need to impress on the doctor sometimes, that day that you're seeing him is just one snapshot in your life, and that might be a good day or a bad day. You need to communicate that to him. And then finally, the last way that I think that you need to communicate with the doctor is when he's finished talking and you think you're finished talking, you should ask any questions that have been unanswered. And the best way to know about those questions is to have written them down even before you came to the office. So if you've done your homework on yourself, you'll understand what the symptoms are. If you then write down the symptoms and then you write down any questions you have about the symptoms, then even on that first visit, you ought to be able to ask the doctor any questions that he hasn't addressed during his or her examination. And if you do that, I think you'll get the best possible care.